Okay, and now we're moving on to discussing obtaining a patient's pulse. Many of you already work as nursing assistants, and you are very accustomed at taking a radial pulse. But because you're learning to become nurses, you're actually going to be working on learning a different pulse, and that's called the apical pulse, which refers to the apex of the heart. So in this presentation, I'm just going to give you a general overview, but don't worry, we're going to be talking more about the apical pulse and practicing it in class. Okay, just as with pulse, or just as with respiration and temperature, we're also going to be talking about contributing factors that can affect a patient's pulse. And of course, here we go again with some of the same influences. So health and disease. There are certain diseases that can affect your pulse. Probably the most common disease affecting Americans is a disease called coronary artery disease, and it's caused by a condition known as atherosclerosis. These are plaques that form in our arteries, and they affect the blood flow. And so, of course, if you have atherosclerosis, you're probably going to have a weaker pulse than someone without atherosclerosis. Another example of a disease condition would be, again, the thyroid. If you have a suboptimally functioning thyroid or hypothyroidism, don't be surprised if the patient has a slower pulse as a result. You can read in your book about gender and age, exercise and exertion, stress and anxiety. Of course, these are things that can influence one's pulse. There are certain medications that are well known to affect a patient's pulse. We have a very old medication called digoxin. Maybe you know somebody who's taking this medication. And this medication can slow your heart rate. Or perhaps you're taking a medication for asthma called albuterol. This drug is notorious for raising the pulse rate in our patient. Fever. When you have a fever, your metabolic rate increases, and one of the side effects of that is that your pulse rate will increase as a result. So that's how fever and your pulse rate can be linked. And then as far as special situations, I would like to mention that sometimes your patient becomes dehydrated, or maybe your patient is suffering blood loss. Maybe they're hemorrhaging from a wound, or maybe they have had surgery and they're losing blood that way. One thing that your body does to compensate for that loss of blood is to increase the pulse rate so that your vital organs can still be perfused adequately. So in the situation where there is a loss of blood, your body compensates by increasing the pulse rate. So that's what I mean by special situations. All right, what is normal? Again, we have normal in quotes, and so that means that there's, variations in humans, but I'll have you refer to your book for normal pulse rates in different age groups. Because in this class we are focusing mostly on adults and older adults, I'll just tell you right now that a normal pulse rate is 60 to 100 beats per minute. And the reason we get 60 to 100 beats per minute is because that is how often the sinoatrial node fires in our atria. So that's where that number comes from. Okay, and a couple of terms I'll just add here. Tachycardia means a pulse rate greater than 100, and bradycardia refers to a pulse rate less than 60. All right, so methods for determining the pulse. Well, if you are a nursing assistant already, The easiest way is to just palpate with your fingertips on your patient's radial pulse. And we'll practice this when we get together in our groups. One thing I'd like you to practice, though, is not only just counting the beats per minute, but also trying to evaluate the rhythm of the pulse rate, whether it's regular or irregular. And also if you could try to determine the strength of the pulse. Can you feel it as soon as you put the fingertips over the pulse site? Or is it hard to find? Would you say that the strength of the pulse is very weak? Or would you say that the pulse is very full or bounding? So those are some things that we're going to practice together in our small groups. And then the next thing that we'll talk about is using auscultation to obtain a pulse. And this is done to obtain an apical pulse. Again, when I say the apical pulse, I'm referring to the apex of the heart. And so when we get together in our small groups, we're going to practice finding some landmarks on ourselves and each other. And then I also want you to review some of the indications for obtaining an apical pulse. Okay, so that's discussed in your book. There is a skills checklist that helps you determine landmarks and also the indications for an apical pulse. And so don't worry about it a whole lot today as you're listening to this presentation, but just be aware it's something that we're going to practice together. And when you go to clinical this semester, you're going to be obtaining apical pulses on your patients.